hello, and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome, everyone. We're very excited today because we're talking about one of those topics that I think often gets missed in our practice. And we have the absolutely wonderful Hope Wills here today. I hope you've been sharing a little bit about this today. We've had an opportunity to sit down with you and actually listen to this recording because it is part of an add-on package that we have this year. So it's very special. It means that people can actually purchase this right away as soon as the conference begins and add it to their cart. So that's pretty special because this whole package will be a deep dive into mental health. Now, your topic is, again, I believe, unique in the respects that you are looking at how mental health impacts the infant. So tell me a little bit about, first of all, I want to know why you gravitated towards this topic. Now, how did you start engaging or finding out about this topic? Because I don't think not many folks are, studying this or training in this area, but you have done both. So tell me, how did this all come about?
So I work at a pediatric hospital, and I had done my lactation training and become an IBCLC, and I was working with one of our psychologists, Patricia Lakatos, who we were working with a family where there was a lot of stress and challenges around breastfeeding. The mother really wanted to breastfeed the baby. The baby was having very big challenges across multiple areas of development. And so I was very focused on getting this baby to breast. And Patricia said, well, okay, but we need to slow down because the baby's not tolerating this and the mother is not tolerating this. And so maybe there's a third path here. And she brought to mind that there's there's another person in the room when I go in. There's that mother, there's the baby, but then there's their relationship. And
Mm,
we breastfeed for 1 or 2 years, but we need that relationship with that baby for their lives, right? For the rest of their life. And so
right.
when we do things for all the best reasons that that cause stress and potentially disrupt that relationship, then it's not good. So that's where it started, where I realized, okay, I have to keep all of these pieces in my mind, the baby,
Mm.
the mother, and I also need to focus on that relationship and making sure that the things that I do as a lactation consultant support and nurture that relationship.
Ooh, I'm having little flashbacks, honestly, Hope. I'm thinking about the families where, I suspected that some of that was happening, but maybe not quite having the right understanding or even knowledge to get into it or really understand what to do next. I'm really actually I've listened to your presentation, of course, so here I am with this knowledge in my mind, that others don't have yet. So I've had an opportunity to listen to you and how now that you look at it and what needs to happen before perhaps we get the baby to latch or get the baby to breast or connect them in the way that a lactation consultant does. I would say it's definitely in our wheelhouse as lactation consultants. I mean, we're there to, obviously to support behavior first, because if you don't have that regulation, you can really see where there's a breakdown in communication. And I mean, I would ask the question right now to our audience, how many times have you sat there with a mother and you just really want to put them together and say, just, it'll be okay, lots of skin to skin and it'll happen. But yeah, there's a lot of that happens today. Have you seen in your time when you've been working with professionals, have you seen that there's been more and more of these sort of you know, uh, I guess complaints or, just watching how, the struggles that professionals, lactation consultants have had working with dyads? Is it showing up more often? Are we seeing more of a dysregulation in our culture and society today? More worries, more stress? What has been going on from your point of view, Hope?
Well, I work at a pediatric hospital, not a birthing hospital. So
Sure.
when babies
Yeah.
come to us, it's because there's already an issue.
Yeah.
So hearts, lungs, prematurity. So
Mm.
that's a stressor right that moment.
Sure. Yeah.
And for example, I work in our cardiology department, and we know that our heart babies do better on mother's milk. We know that. We see it. And so
Mm-hmm.
we say, oh, we want your milk. We want your milk. And we want baby to get breast milk. And we want to get the baby to, and the parents are still so traumatized
Mm-hmm.
by some of the postnatal events. Maybe the baby needed to have surgery right away. And and so they haven't had a chance to do skin to skin. And now I'm saying, okay, let's bring that baby close. And I'm like, but what about his sternal? Can I bring him close to me? Can I do that? Um, and when they go home, and I think that's where I see some of the patients on the outpatient side as well. When they go home and the mom has been trying to fortify her milk and pump and breastfeed and take care of a baby with a complex medical condition, right? We talk about triple feeding. Well, if you're breastfeeding and you're pumping and you're fortifying your milk and you're changing oxygen tanks, it can just all be too much. So that's where I see some of the stress. Our
Mm-hmm.
our lactation consultants do, I think, a fabulous job, I have to say, of meeting families where they are and helping them to find that place of regulation.
Mm.
And but I think some of the pressure just comes from the parents themselves. They want to do everything possible for
Mm.
their baby. And so, I've had moms say, I'll do anything, I'll pump. I'm like, but you only have 24 hours in a day.
Right.
So let's talk about this.
That's awesome. I mean, I know, again, I'm excited to see your presentation again with, of course, our, participants here for the Gold Lactation Conference, really getting that insight on what are the steps. I know you're going to be talking about that and, ways to support the infant and different approaches that you can take. These are really big things. These are things that we are going to be able to put into our tool belts right away, and with it, that is a family, like you said, you deal with those, very intensive cases. But this will help us also, deal with any case, I feel, where there is any amount of dysregulation that's happening, any stressors, which I think we see a fair share of as well, in the community today. Thank you, Hope. Your work is just so beautiful. And I just have loved, having you here as part of our conference. And I sure will look forward to hearing from all of our participants as well on how they're going to be able to use all of this amazing work in their practice. So thank you again for being here today.
Thank you for having me.
And for all of you listening in right now, don't forget, right now you can head over to our Gold Lactation conference at goldlactation.com. There you'll be able to sign up for the conference. You'll also be able to add in this very special add-on package to your registration. So don't forget to look for that on the dashboard. It will be so good to see so many of you there live. And of course, this will be a recorded event that you'll be able to listen to at any time. Thank you again to Hope Wills for being with us here today. And of course, to all of you, our audience. Bye-bye for now, everyone.